Not everyone has equal access to the support they need. Since the pandemic, VCS and council colleagues across Hackney have been working together to implement fairer ways of working, practices that are trauma-informed and anti-racist. How people work together matters. We can't solve Hackney's problems alone, but by putting residents first, listening to communities, building trust, sharing power and knowledge, we can strive to make everyone's lives better. We call this fairer ways of working.
Today we've been meeting the community infrastructure partners, who are 24 organisations that Hackney Council have grant funded from 2022 to 2025. What we've been hoping to do today is speak to those organisations about the impact that their work has, more than just the numbers. So you might be able to, what does one meal mean in terms of what it means, the impact of a family? So the confidence that coming to an organisation might bring, or the unexpected things that happen when you kind of work with communities.
Our poverty reduction tools for frontline staff sessions have been running for about 2 years now, and they've been a really useful way to not only share practical information with council colleagues and our partners across the voluntary and health sectors, with useful information they can signpost residents to, but also a really valuable space for us to come together, connect and share insights.
And it's not just them, it's any other services that we can work with throughout Hackney Council. We're very open to that, including public health and other organisations, tastes for food, get whoever is, they're always welcome because they know these residents are going to be there. And we form that relationship and that collaboration to keep going.
So I'm part of the Hackney Money Hub team, and we're part of the poverty framework, poverty reduction framework within Hackney Council as well. So we sit actually underneath this service already. We do have a lot of residents that generally don't always find it comfortable to speak to the council in general, or even approach the council. So to have these sessions with other organisations to show that there are friendly faces behind the council, that we are here to help and support residents.
There is a lot of support for English-speaking clients. However, people from different backgrounds sometimes struggle to navigate the system or understand what support they are entitled to or have. So inclusivity in language.
It's getting the message out to them, and maybe going on the street and talking to people and making them aware of what's available for them, because I think people can get stuck in a hole of depression and isolation, and it's about trying to pull those people in so they can engage with the services and get the help they need. Because it's not all about money, it's about mental health.
All over Hackney, frontline staff and volunteers in community organisations, health and council services are doing amazing work with limited resources. We want to thank all frontline staff supporting those furthest away from services. Please keep in touch and stay connected. There is power in the collective. Together we are strong.
So what do people think? There's loads of claps. Are we happy with it? Does it represent what we do in this space?
Yeah, it was great. I wish it was longer.
No,
There's so much more going on, but that was really, really well done. I hope we get will we get a link to share it with our own areas too?
Yes, this is it. This is the point.
Lovely. Thank you.
Yeah, we're hopefully, well, we wanted to share it with you. We wanted you to be the first to see it. And if you're happy enough with it, we'll get it up on the YouTube one, and we'll set up a website for it, a web page as part of the Hackney website to begin with, but it can be directed from any other links. So we'll be looking to sort of set up links across to all of your services if you want to highlight some of these resources, for example. So, we're open to all ideas about how we use this stuff, but we just hope that you feel that it reflects what we've all been sharing here and what we've been doing together in the work that you do and what matters to you and the residents you work with.
I thought the design was really good. I really like the design, the content, the comic style, the colouring. I thought it was really good. Nice, eye-catching, something different, not just like council sort of style, generic-y. So yeah, really good sort of eye-catching piece of work. Nice and not too long and captures what you need. So yeah, really, really good. I thought, love it.
Real. Oh, and thank you so much to everyone who helped us make that film. Chanel stepped in at the last minute here and did the voiceover for us, and we've been working on getting that script right up until sort of it was on Friday, wasn't it, that you recorded that voiceover, Chanel? So thank you so much to Chanel for that, and to all of you that have contributed, but to Yeah, and to being our first audience. So we'll share the link with you in the newsletter for dissemination, and we'll keep you updated on the other bits as well. But if no one's got anything else they want to share now, email us if there's any other feedback that you have that you don't want to share in the meeting, or put something in the chat. But interested in how we might use it, as well as, you know, if it feels like the right thing and what other things might be needed. But yes, over to the agenda now. I'll pass back to John. Thank you.
Thanks, Jenny, and yeah, thanks everyone for the feedback on the film. Thanks, Janine. So we've got 3 people are going to be talking today. So Fiona is here from Citizens Advice to talk about some first aid training that they've got. Krista is here to talk about her exciting new work, a new initiative, which is going to be great to hear about. And Rohit, I'm not sure he's on the call yet. He's here from YOH, which is an organisation to support young people. I'm going to come to you first, Fiona, if you're there. So feel free to come in if you're there.
Yeah, hi. Hi, everyone. Yes, I'm here to, well, a couple of things. Publicise course we're doing that's called First Aid Advice First Aid. People get confused. It's nothing to do with breaking your arm or anything like that. It's a whole set of training that was developed, I think, through our head office. And we supported some people that were doing it through the Wandsworth office, but we're doing it now ourselves in Newham and Hackney. And I think another organisation did it in Tower Hamlets. So basically, I'm delivering a session on the 3rd of June at the, I can never pronounce it, the Addis Agaba Centre. I can never pronounce it, the one in Dalston, the lovely community centre in Dalston from Hackney CBS.
Antiaga Centre.
I picture it, the AA, and it's like, I don't picture
CBS
it.
building, it's the CBS building.
Yeah. So basically, the course is like pretty well a full day. It focuses on a lot of the places that you can refer people to in Hackney and local information. It's for people who are not advisors, but say frontline workers who would like to know a bit more, or volunteers, or people who want to know a little bit more about what's available in the borough, but everyone's welcome. And it starts off with some of the local information, and then there's a set of exercises. The idea of it is, so if you're a frontline worker, but you're not an advisor, how to spot where there might be a debt problem, a housing problem, a benefit problem, to get a bigger picture of what it is that your resident or client might need, and have a better idea of where it is you could then signpost them or refer them to. And there's lots of time for questions and answers. Some of the sessions have ended up being a lot of just sharing information, because all the different people that come to it, sometimes we might not know their organisation. So it's very, very useful that we just kind of cross-share, find out what it is everybody wants. So I'm looking for people, and you can register. I'll stick it in chat, but if you can stick it in the newsletter. I'm trying to get people to register as soon as possible. I'd already said this to Krista and to Alex as well, so I'm putting it out there. So we need to get enough people, up to about 20 people, and we could also do waiting lists, because I think we're doing more of these as well. But people get a lot out of it, because they're not always aware of what's available and how to access it. So it works well with this forum. And while I'm here, we've also got our energy projects, so I might as well promote those as well. We've got a large amount of energy advice work going on at the moment across the 3 boroughs that we work in, Newham, Tower Hamlets and Hackney. And at the moment, we've got people going to the service centre on a Monday to pick up clients. But it's basic energy advice. We've got another project with some casework, but this one's more basic energy advice, switching, bills, any problems people have got. But we can also do home visits, which most of our advice can't. So that's very, very useful. And I'll put that up in the chat as well. It says they can help with reducing with energy bills, energy advice, disputes, energy efficiency, problems with suppliers. We can apply for grants and hardship funds. They can apply for separate types of fuel vouchers, separate from the ones from the council and that. And it also includes benefit checks and further advice. And if they need other advice that's not part of that project, they get booked into one of our other projects. Say if they wanted PIP forms filling or challenging a decision, we can then book them into different projects that we have. So they're looking, it's quite fun to see quite a lot of people. So I know the council are doing some of themselves, so we're not trying not to step on each other's toes. But I say we've got home visits. But if you've got anybody with any energy wants to, there's an email they can email. I'll stick that I'll give that to John, stick it in the chat, or leave a voicemail, and somebody will book them in pretty quickly because we've got quite a lot of capacity on that. And also we're still doing schools projects, people who've got children in Hackney schools. So that's quite useful. We're at several of the schools at the moment. So there's different routes to get us.
What's the schools project fee? What's the Hackney schools project?
Well, basically, it's been funded for helping parents of a child in Hackney school. It doesn't have to be anything to do with the school. If they're in a school, it's just any of the services.
Okay.
Originally, the idea was that you were embedded in the school and you saw the parents from that school, but that's not been working so well, trying to get the parents. So we're seeing parents from any school.
Okay.
So a couple of schools, if the parents are at the school, I think it's Scholastica, Clapton Girls, Graysbrook, Kingsmead, Thomas Skinner at the moment.
Could you send me a list of that over, because I'll share it with the closet side, my community side. So if you can share that over to me, I can share it with the families. That would be good.
Yeah, I've got leaflets and everything for that. And if they can't go into the school, because some of the schools won't allow parents from outside to go physically in, we'll do it by telephone. But if they're physically, the child's at the school, we can do it face to face. But we've usually got capacity in that, because we're still, trying to publicise it. But the parents sometimes go in, drop the kid, and dash off. So it's trying to capture the parents. And we've also got a new project at Hackney Food Bank, where we've got a dedicated advisor down there 4 days a week now, which is really, really useful. So people who are needing food bank, they can get an appointment there, or if anybody wants to refer to that, you can also email me and I get it, because she runs her own calendar, because it's quite ad hoc and different from our usual way. So the idea for the food bank is they want to reduce the amount of people needing to go there. So they funded that, so anybody who's asking for food and that, we can see them through that project. So just get in touch with me. I think that's it. Unless anybody's got any questions.
Thanks. Yeah, I was actually going to ask. Sorry, go on, Krista. Go on.
No, just if you could send me the flyer, definitely, for the families, I'll get that out to the closet families straight away. The family stuff that's available. Thank you.
Yep, no, it's good. The more the merrier. We need more people.
Yeah, that was great. Thanks, Fiona. Loads going on. I was going to ask about the schools. I was just curious, how did you guys go about getting into those schools? Was it done on a school by school basis, or did you go by the council, or how were they sort of organised?
No, we did it ourselves, basically.
Yeah.
One or two of them slightly started, it didn't work so well, so we changed schools. So there's one or two I'm thinking of, like the Kingsmead. I just met somebody at one of the sessions that somebody did,
right.
And they were saying, oh, we'd love to get advice. How much do we have to pay you? And it's like, no, actually, we can do it for free because we're getting paid. So it was just finding the right head teachers that were really key to get us in and to get us spread across the borough.
Yeah.
All in one area. But it wasn't through the council. We emailed. We didn't get a lot of response from a lot of people. So it was
right.
It was more making personal connections and talking to people.
Yeah, I was just curious because we last year we sort of helped organise some coffee mornings in schools with lots of different partners and council services there and that sort of thing. But
that's what it was. Yes.
Oh, right.
John's Jerusalem.
Yeah.
Yeah, it was there that I met a woman from Kingsmead who was very good.
Right.
It was those sort of things where you meet up, and another one, I met somebody at the food bank when they were doing a demonstration of how to fill the boxes. So it's those kind of personal connections through all this community stuff is how you do it.
Yeah, definitely makes sense. I was just interested because that always seems to be the case with schools. It's quite hard to have more of a kind of strategic approach almost. You have to kind of do your best to, like you say, cover all bits of the borough, etc. But yeah, sounds like a really great project. So if you've got all that info, send it across to me for the newsletter.
Yeah. Okay.
Does anyone else have any other questions for Fiona? No.
Okay.
All right, great. Thanks a lot, Fiona. Cool. I am going to pass across to Krista, who is going to tell us all about her new initiatives. So please take it away, Krista.
Jenny's really smiling at me, and I can just have a feeling of pressure today. So for those of you that don't know me, I'm Krista, and I'm currently the engagement and co-production manager at Healthwatch Hackney. I've been there for 18 months. I started on a 3-month contract and it got extended for 18 months. Sadly, when the NHS cuts were announced recently, my contract was one of the first to go because it was an outsourced contract. I've been working in the sector for 7 years. A little bit of a backstory in a couple of sentences. I came from a really sort of successful consultancy background in large scale event management. So when people say, Chrissy, you're so good at linking people and places and connecting, it's because it's all I know. I used to have 400 staff and probably 30 events on every weekend. So that was my background. Ill health, I had a TIA in late 2017 from the stress of having my own business. And that catapulted me into having an early retirement from an industry that I've had for 30 years. And the grief of that then really hit me the year after. I didn't realize I was grieving. I thought I was having a mental health breakdown. I thought I was menopausal. I thought it was a million things. And it was only when I went to therapy, they were like, no, you're grieving. It's the loss. It's the trauma of what you've lost and stuff like that. So I came into this sector, always been a volunteer for 25, 30 years of my life. I was a care leaver. So I've always been the sort of person that's worked with underrepresented communities and tried to help people from those communities. So I thought, I'm going to come into the VCS sector. Unfortunately, when I came into the sector, I had no paid experience, age 47. So I went off to do a master's, and that was how, some of you will know, I've got a clothing bank away from work called the Community Closet, and that was how that was born. 5 years later, you'll hear about the closet now in my presentation, but 5 years later, the demand for the closet is bigger than it's ever been. It gets bigger week on week. It started as a uni bit of research in the pandemic year, and it's 5 years later, we've been catapulted forward. I've now done 6 years in the sector, starting as a volunteer, and I realised in my redundancy, I was applying for jobs as CEOs and chief execs, and my friends were like, why are you not going to be a CEO for yourself? Like, you've got this amazing idea, make it happen. So some of you have had an email and got an outline of what I'm planning on doing. I hope the rest of you enjoy it. It's happening. To give you guys an idea, I became a limited organisation yesterday with my accounts and stuff like that. So nerve-wracking. It's been a very, very busy 24 hours. I'm definitely hoping that we're going to be part of the fairer ways of working. So hopefully we'll be definitely part of this team. It's definitely on my list for next week. Thank you. I can see everything going up. So I hope you enjoy the presentation. I have never presented this before. It's not the final. We're still tweaking it. So I'm extremely nervous because it's like a completely new bit of work. So hopefully you guys will be as excited about it as everybody else is. Can I share screen from here? I can go to present in Teams, John, yeah? And it should go. Oh, no, it's not going to work like that. Hold on.
Yeah, it's not Teams, it's the bottom square. That says,
oh, where do I go? On the meeting, yeah? Hold on, let me come back to the meeting.
Smiley face in the meeting.
Smiley face in the meeting. Oh, the 3 dots, yeah? Okay, cool, yeah, I've got it. 3 dots? No, the 3 dots, where's shit?
It's the button that has a square and an arrow inside it.
Hold on. Oh, that one. Okay, yeah, now I've got subtitles. Let me take those off. Hold on and go back to this one 1 minute. Okay, hold on. Sorry, people, bear with me 1 sec. I'm not great on this one. All right, give me a sec. Let me find my window. All right. Hopefully this will work. Let me know you can see it. Okay. Can everybody see that? All right.
Yeah.
Is it on? Have you got a single slide? Can you see a single slide yet?
I think if you go into.
So if I go to my slideshow now, yeah?
Then you need to share.
Okay, cool. All right, let me go to slideshow from beginning. Is that working? Is that on the first screen? Okay.
Yeah.
I can't see anybody, so I'll go through it. John, if anybody wants to ask me anything along the way, can you navigate hands or anything? I'm happy to do questions during or after, however people want to do it. So welcome to CoCreate Hackney, people, place and purpose. The logo, everything about this business is resident-led, created by residents for residents and to help benefit system services and organisations. Residents have literally been behind the scenes. So I came up with the first drafts of logos. There is a team of residents that are working behind the scenes, co-producing everything you see. So a couple of ideas got added in yesterday and they definitely came from a resident. I was like, they're amazing. We can definitely do that. So this has really been built by the community. We're new, we're very bold, we're very different from what's out on the market. I'm very fortunate that I've had 10 years of very successful consultancy, so I kind of know what I'm doing a little bit more. And this is our sort of impact statement, for want of better words, and this was designed by residents. We're real residents, real voices. It's a place for people that are powered by purpose and driven by impact. So that will be the line. Very nice to see that people have already been saying, oh, it could be co-create Croydon and co-create Newham. So apparently people are seeing a vibe for like a whole Pan London thing. So that's quite a good sign. So a little bit about us. We are a consultancy, but we're very affordable, very, very affordable. We're community rooted, a consultancy and volunteer agency created by residents for residents. Everything about the business.
Sorry to interrupt.
Yeah.
Are you trying to go on to slide 2? Yes.
Yeah.
Okay, we can't see slide 2. We're still on slide 1.
Oh, hold on.
Yeah, it's not like a slideshow. I think it's.
Can you see it?
That's it.
See it now?
Yeah.
Oh, yeah, that's
I'll
better.
do it like that then. Okay, cool. So you guys can also you can just see a single slide, yeah? Because I can't see anybody. So you just see a
Yeah,
single
we can see the slide you're on, and then we can
Okay,
see
cool.
the slides that are coming up.
At
But
the
yeah,
left, yeah?
we can see the
Okay, cool. All right then. Thanks, John. I should have sent them to you before, sorry, and then you could have shared
It's
it
all right,
from your
don't
end,
worry.
sorry. They literally just got finished about 2 hours ago, so it's new, it's hot off the press. Literally, this is the first audience to hear this, so I'll be really pleased actually to hear everybody's feedback. So the agency is led by lived experience. It's absolutely grounded in local insight. I've been a Hackney resident myself for 38 years now. Both my children, my grandchildren, everyone's grown up in this borough. I've seen the good side of it, the bad side of it. I know what works, what doesn't work. Everything about this business is built to shift power and co-create change. We are community connectors, and our volunteers will be known as community shapers. And we think that the word volunteer is overused. We think that automatically, oh, do you want to volunteer? It's like, oh, what were you kind of doing for free? We think volunteers can sometimes be a little bit not used and abused, but underappreciated and they do it for free. And we feel like community shaper is a much more positive word. And the community shapers said, oh, it will look really good on our CVs that we do this, much better than volunteer.
Yeah,
So,
I agree.
We were playing around with different names, neighbourhood navigators, change navigators. As I said, there's been a team of residents come up with this. So we know that we're community connectors. That's what CoCreate Hackney will do. And the volunteers, as you know them, will be community shapers. The legal structure of the business, I've just told you, we've got our company registration number, so excited. Limited company with a social reinvestment model, so all of our profits will be reinvested back into the community, which is something that's really important to me as an individual, as a person, as a human, and also as a business woman, and also all the reps, the volunteers that we're working with, the shapers, to them as well. So the purpose of CoCreate Hackney is to shift the power back into the hands of Hackney residents. We want to connect people, systems and services, bridging the gap between lived experience and decision making. You probably heard that tagline a million times over, but we're a little bit different. We really believe that real change starts with real people. Why now? So why now? We've got other organisations. There's all these different organisations in Hackney who are doing amazing things, but it's about connecting them all in one place. And that's something that I'm very good at, and I'm not scared to say that. And I think it's one of the strengths. I think sometimes it's good to say what you're good at and things that other people are going to be better at than you. And we are community connectors. It's what we thrive on doing. It's what we're really good at doing. So why would we not accentuate that as one of our skills? We know that Hackney is very rich in lived experience, grassroots action, frontline insight. This room is now full of people that frontline insight can bring that. But too often these services exist in silos. We know that services are stretched, there's cuts coming left, right and centre. Communities are disconnected from decision making. They're getting cut out, definitely, sort of at system levels. Resident engagement is kind of being put to the bottom of the list at the moment with all these cuts going on, and the systems that are meant to support all the people are actually struggling to respond with equity, creativity quite a lot of the time, or speed. We all know about waiting lists for services. So we feel like now's the time for something different. After working in the industry for 7 years in this sector, I've been able to come in with like an organisational perspective. I think of everything organisationally, so it's probably not great for the people I've worked for, but for me, I've got like that organisational brain, so I've been able to spot where there's gaps, where things I think could be done better, where things could be different, where things are a little bit stagnant, a little bit complacent and just taken for granted. And I want something with a lot of joie de vivre. Our office is going to have a lovely buzz about it, good energy, thriving. It's going to be a community rooted space. The office will be staffed by volunteers. Initially, they'll start as community shapers working in the office. Within 6 months, we're hoping to make them to paid roles as they upskill themselves as they go along, and it'll be a revolving door of community shapers working in the office. It's going to be a one-stop hub for co-producing better services, sharing real-time insight, supportive, inclusive participation, connecting residents with meaningful opportunities, which we'll talk about a bit more, and empowering systems to listen, respond and evolve. The infrastructure we're designing is specifically designed to make collaboration easier, engagement more authentic, and ensure the change that we're doing is sustainable, because all these pockets of work are great, and we do these pop-up projects here. We do, for example, John, remember the step stall that we did last year, the winter stall? That was so good, but it was a pop-up for that period of time. Like, how do we make that more sustainable? Like, how do we make things long-term? Because that's when we'll actually see the inequalities reducing. So the $1 million question, I guess, is what are we going to do? So this is kind of the outline of our services that we're going to do. There's a couple of other bits which I'll talk about in a minute. The community-led consultancy, so that's there to shape services, strategies and policies through the lens of our lived experience experts, our community shapers. Also, we will lead on community events. So with people, my background's obviously event management, why wouldn't I tap into that? We all know I bring a full house, it's my thing. I'd be worried if I couldn't bring 100 people in a room after 30 years in events, I'd be slightly concerned. So if anyone needs advice on getting an event put together, or they want support with their promotion, or maybe they want somebody to manage the whole thing for them, we can do all that kind of stuff. Engagement health check, so we're going to be auditing, so we can come in and do half day, 1 day, up to 5-day workshops at auditing how organisations are listening, responding and including local voices to co-produce their services. So that's where we'll come to you, we'll do your health check, and we'll leave you with a pile of assessments and tools and recommendations of things that you can do moving forward. Training will be a big shot, so workshops and capacity building and training kind of in the same guise. Lots of practical support and training going to be offered for residents, teams and frontline staff. Thankfully, from my background, I already know about accrediting courses and stuff like that, so I've already been in talks with Pearson and a couple of other learning providers. So the safeguarding course that I've been delivering, which has been really popular, that's going to become like an accredited course. I'm also going to be doing more specialist engagement, so there'll be packages of training available for like community shapers, volunteers, champions, residents. There'll be training available for VCS, but there'll also be system training available. I've been asked to develop my Ripple map workshop. You'll be pleased to hear, Jenny, by about 10 people. Can I come and deliver some training about that? People want to know more about that. So there'll be a Ripple map training. So there'll be some engagement specific training that I'll come out and do with people as well. One-to-one facilitation, so that's more working with residents, IAG, making sure they've got the right tools and training plans in place, stuff like that. Maybe they're struggling to navigate systems or the roles that they might be in. Community connectors, so linking people, places, stuff like that. That's what we do. So the local loop, those of you that have been on my radar whilst I've been at Health Watch will know that I sent out a weekly update. Mostly, it started on a Friday, then it went to a Monday, it varied a bit, but it did become a weekly update every week, and it was really, really popular. So the local loop will be the weekly update coming out now, and the name of our monthly newsletter. It will also be a page on our website where people can advertise projects, services, schemes, things that they want. So like a page that people can go to at any one time and see a visual, like a flyer displaying those, the graphics on it. I'm seeing the website being built behind the scenes at the moment, and it actually looks really cool. Like, I'm really excited to see that page up and running, because it's like a centralized notice board, for want of a better word, with visuals that all residents and systems can access. So we're really pleased with that. We're going to have a volunteer placement agency. Why would we not? And one of the other things that we're going to do is give all of our volunteers are going to go through an accreditation scheme. One of my reps, Emily May, who works at the Homerton, some of you might know her. She's amazing. She's a brain of a genius. And she was like, we both felt really passionately that volunteers in the traditional sense don't really get enough accolade for the work that they do and the hours that they put in and stuff like that. And we were thinking like Duke of Edinburgh, we started playing around with all these ideas, and then we started looking into it, and there's actually some really good volunteer accreditation schemes. So all of our volunteers will be offered the opportunity to go through that. We think that's really important. We've got voice and visibility, so our focus groups will be known as insight labs. We can host panels, storytelling sessions. We've got art facilitators that can come and listen to your focus group and then produce an art word cloud, you know, like at the end of it, or a painting of what they've heard and seen in the room. So we're bringing in like a whole wide range of different styles of speaking to residents and ways of getting that information, which we thought was really important. Probably one of my favorite things that we're going to be doing is the next slide, and kudos to Emily. This was absolutely her idea, and this is why it's so important to have co-production and listen to people, because I thought I had a really good model, and as soon as I sent it out to a few people and said, like, see what you think of this, like, I've got to present tomorrow, like, have a look, see what you think. And Emily and I were on the phone till like 11 o'clock last night, and she came up with this completely by herself. I was actually kicking myself that I did not think of this myself. it's because it's a brilliant idea, and I'm not going to take any credit for it at all, although I will be working with Emily to develop it. So we're going to be having a CoCreate Hackney inclusion friendly scheme, so which is to celebrate and incentivise local organisations and employers who are demonstrating a commitment to inclusive employment, skills development and support for Hackney residents, especially for anyone facing barriers to work. So it's not about just being an organisation that has loads of people with disadvantages or different people volunteering for you. That's great. You might come in at bronze as an inclusion advocate. It's about taking those people, recognising the organisations that take those people and see, you know what, this guy's been volunteering for me on my reception every week for 6 months. He's always here. Like, I think I should give him a job. It's about upskilling them and getting them into employment and stuff like that. So we're going to have inclusion advocates at bronze, silver will be community builders, and gold will be our equity leaders. I feel like John and Jen, you're already equity leaders. I feel like you guys can come in on gold at the council already. You're very good at all this kind of stuff. So yeah, we're designing a logo, and there's going to be a whole scheme around that, which we hope organisations will want to be part of, because in a diverse borough like City and Hackney, I think it's really important to have some kind of acknowledgement that you are doing the right things. So moving on really quickly, the community closet is our social reinvestment model. Also, Morningside Community Centre is one of my chosen partners, and we're looking at another couple of options. All profits from this business, I have to get paid. I haven't, to be completely transparent, although we're a business and we have to charge, so we're not like a charity and it's not all funding and stuff. We can apply for some funding for things, which we will be doing, but I'm being very transparent. I've salaried myself at £40,000, which is £5 knock on what I'm on at the moment. I've gone down, but I've settled, that's what I've gone in at. So people know that although we're a business, this is not about like making millions. This is about paying the bills, paying myself, and everything else going back into the community wherever possible, because the community really needs it. So our main project that we'll be supporting will be the community closet. We'll be investing in that. The closet has been open for 5 years. This is our new logo. We've already helped 2,750 families in the 5 years that we've been open. 2,750 children, and 1,000 and something families it is. I haven't got the stats to hand. So yeah, we've been very busy and demand. We're now not doing just children, which is why we've kind of rebranded. We did a supply needs assessment earlier last year because we kept getting asked for adult stuff all the time. So we did a new supplies needs assessment, and we were like, okay, we need to do it for everybody. So the community closet is for everybody in the borough. The idea will be the space. I'm in talks with Hackney Council, actually, with Coralie John, about a space that can hopefully house them both. And the idea is to have a permanent sort of shop front open. It might not be in a shop necessarily, but a place where people can come in Monday to Friday and access this support that they need to. It will have its own model, the community closet, which I'll share probably around the end of June. That will be ready. So who are we looking to work with? So everyone in the room, we're looking to work with you, of course. Delivery partners, if you've got any ideas or work streams, we can help co-produce, co-design and deliver with our community shapers. Commissioners, funders, helping us to scale pilots if you've got anything. Local partners, if you need training, do you need advice, do you need volunteers? I got my first, really quite exciting, I got my first little gig for CoCreate today, and it was, can I design? He really likes the flyers I design, and he's got a series of events at Bangor Housing Association, and could I design some flyers for him? So it could be something as simple as that. So it's not just me, by the way, there's going to be a team of us, so it won't just be me doing everything. And then networks and allies, I think it's really important that we platform each other. We want to platform everybody. We definitely don't want to be silo. So we hope that other people want to platform us as well. There are pilot offers now available, so anyone that wants to have a chat with me, we open officially on July the 14th. I leave Healthwatch officially on the 8th of July for transparency, so I won't officially be able to do any work until the 9th of July. So we officially start on the 14th, but if anyone wants to have a chat about something that they think can start from then onwards, we're running pilot offers for the first 8 weeks that we're open, so please do get in touch. I need some people to do some pilots with me anyway, so please, because we need to test the services, so please do get in touch. Last slide. So I really like this picture. I think like it's a really vibrant picture, and even though it's an animated image, I think it's really like Hackney. You could go to a community lunch, you could go to a community garden, and residents will look like this on a good day. So just the bullet points: we're resident led, we're inclusive, we're bold, new, very bold. We're going to be very different, very practical, and we're absolutely driven by equity. Ready to go live, ready to partner now. If anybody wants to talk to us, then last slide, that is all of our details. So this will be, I can do make these available, John, if you want to share them with people, if they want the contact details or anything like that.
Yeah, definitely.
I hope everybody enjoyed it. I don't know, I couldn't see anybody, so I'm going to come back to the meeting now. I don't know if it was any good or not, but hopefully people like the idea.
It was really good. It was really good, Krista. Well done.
All these claps. I know it is hard because often people keep their cameras off when the presentations are on, or it goes up on YouTube, so people don't always want their faces on. But yeah, you can see from all
over
the chat.
over there,
Wow.
you can just literally see the screen that you're presented on. So I could not see anything. So any questions, anybody? Hopefully, what do you think? What do people think? Do they think it's a good idea? Do they think it's going to work? Batcher's happy. I saw, look, Lucy, I saw a thumb go up. Thank you, Hannah. What do you think from the council perspective? I had like a lot of support from the council. They seem quite excited about it, which is quite nice as well.
Absolutely. I think your work. Yeah, Patricia, you come first. You come in first.
Pat's actually one of our community shapers. So this is,
of course, yeah.
Go for it, Pat.
Come on in.
Hiya. Sorry about the noise. I'm just in a shop, but yeah, like I think it's an absolutely brilliant idea. It's a way to get people back into the community that feel like they were, not labelled. I think it's like labelling, giving us platform to change it back to the community. And I think it's all about labelling, getting everyone involved, especially the council, because these are things that we need and much more. So yeah, I'm glad to be part of it. It's done so well for, the brunch bunch. It is there's a bunch of us basically from backgrounds of, different backgrounds, and we all come together for brunch, and then it's set up, Krista helps us set up the brunch bunch, and I'm so happy for it. And I can speak to the other, bunch of us that we are so happy that it's here and we're allowed to be elevated.
Thanks,
to
Pat.
our next level. So yeah.
Thanks, Pat. So for those of you that might not have heard Pat properly, she's part of the STEPS work that I work with every other Friday, the STEPS project, and the Brunch Bunch is their own co-production group. If any of you saw the STEPS presentation that I did in January, the winter work, that was off the back of that. So thank you, Pat. I appreciate that. Got a lot of work to do yet.
Yeah, we met the other day, didn't we, at the Health Watch event? It's lovely to see you, Pat. Sorry, Annie.
Yeah, it was.
Could I just come in and just to make sure we don't forget Batu's comment in the chat, which I didn't know if you'd seen that, Chris. You probably didn't see it because you were presenting, but it was just about just the colours of the fonts, I think, on the slides in terms of accessibility. So Batu was saying,
no problem. I've got a black and white set that I can dispatch. No problem at all. I've got a plain black and white set. I'll get them over to you, John. No problem. Thank you.
Thanks, Chris. I just didn't want to miss that. Batu is actually going to be coming along, I think, to a tool session in a few weeks' time to talk about accessibility in terms of content. So that's going to be really good. I'm going to come to you now, Genevieve.
Thank you, Krista. This is so exciting. I had forwarded your email. I made myself a note to forward the email to John about the information this was coming up, and there you are speaking at us today. So John, ignore my email. You're already on top of it as usual. I have a couple of things. First of all, I'm with Benefits and Homeless Prevention Service in Hackney, and we share a monthly newsletter with our temporary accommodation residents. And for those of our TA residents who are in Hackney, it would be very important for them to see that this is available to them. And the other thing I wanted to point out, which is a learning we have we put out a monthly newsletter to our temporary accommodation residents, is to provide a QR code in the document, because if you update it and all they have is a printed copy and there's more updated information later, having access to a QR code might be helpful.
Thank you very much. Thank you, Emily May. And I've got a couple of learning disability specialists on my group of steering residents, and they're amazing at picking out things like that. But yeah, I've made a note of it. Thank you very, very much. I'm glad people enjoyed it. If anyone wants to talk, let me know. Let's have a chat. Let's see what we can do together. So thank you for having me, guys. Thank you.
Thanks so much, Krista. You've been busy, and I can tell you're going to be much busier So is it really exciting to see? We'll definitely be speaking.
Very nerve-wracking. It's very nerve-wracking. It's exciting but nerve-wracking as well. Busy and nerve-wracking, but yeah.
You really see how, from all of the work that you've been doing in all the different spaces and in capacities, how you've really brought together something that speaks to the lived experience of those you've been working with. So I think,
well, we're in conversations with the community halls department at the moment. So I'm in community spaces. There is a loose conversation going about. I'm sort of pressing the need, and I think people in the room will probably agree with this, that there needs to be some kind of community hub for community projects. So somewhere where there's a food project, digital support, a clothing bank, just a hub that people can go to, IAG, maybe a space in there that residents can lead their own projects as well, you know, like a revolving space of different, more creative projects. So I'm trying to get a building, if the dream plan works, I'm trying to get a building that CoCreate and Closet will be based in, but also I can bring other services into as well. So we'll keep everybody posted. John will know as I know. So yeah, we'll keep you posted on developments.
Please do. And I've just seen Claire's only just been able to join us now, but and so missed your presentation. So if you can send that over right away so I can share it with Claire too. I know that yeah, we'll all be really excited to support your work however we can, but love to pick up some conversations with you, because I think your offer for some introductory projects, we could help you. You know, we can definitely do some work together quite quickly. I mean, we've still got the session in tomorrow if you wanted to join that session tomorrow and join us
tomorrow, because I've got the Closet event next week. So there's a massive community event as well next week. I'll drop the link in the flyer if anybody wants to come to it. Yeah, we've partnered with Morningside for it, so I'll put the link in the flyer for it. If anyone wants to share it with their networks or attend, feel free. I'll stick it in now.
And just in case you missed it, Krista, there was a comment from a former youth co-production lead who is working in the early help system in Hackney, who was in the call, who just had to leave, and said that this has put a massive smile on my face. This will be so impactful, and love the accreditation and thinking about upskilling. So more positive feedback there for you. So
thank you very much. Thank you for having me.
Keep coming back, Krista, and keep us obviously
definitely. Thank you.
Evolve. You know, we
get a meeting in the diary, Jen. Thank you so much. Thank you.
Jahada, do you want to come in? Jahada, are you got an accidental hand, or are you struggling to find mute? It can sometimes be hard to know, can't it?
Maybe an accidental hand, I think.
Maybe, yeah.
Oh, I can't unmute myself.
Can't unmute yourself. Oh, how frustrating. Do you want to put it in the chat, Jahada, and we can share it if the technology is failing us? I'm going to put something in the chat. That is frustrating.
I was just going to.
How do I drop a document into the chat? How do I drop a document in? Can I?
You just have you got a link, or is
I'll email you it now.
Yeah, just send everything to me and I'll put it in the newsletter. No problem. I was going to say, actually, I really liked what you were saying, Krista, around wanting to make sure things are sustainable, because we do lots of work. I'm thinking about the council tax project that we've been working on. You know, there's lots of good one-off things that happen, and then it's how do you turn that into something sustainable. I just think that comes up so much in our work, so it's really good to hear that you're thinking about that as well. So yeah, I think, and all of it sounds fantastic, so yeah, really looking forward to seeing how we can work together in the future.
Definitely.
Jahad, I don't know if you...
Hi, sorry.
Oh, hi, Jahad.
Hi, everyone. I'm Jahada from Family Action and from Hackney CVS. Just a quick question to Krista. I know we've communicated before. You mentioned in your presentation about community connectors loop. In one of the slides I saw.
Community connectors and the local loop. So yes, we as a community connectors as an agency, and the local loop is going to be our update, the name of our sort of weekly update and monthly newsletter, but it will also be a page on our website where people, projects, services, organisations, whoever, if they've got anything they want to advertise, we can advertise it on there, and it will stay up for as long as you need it to stay up, kind of thing, if you want it up for a month or whatever. So like Fiona's first aid leaflet or whatever she needs, you know, like things like that, you can just send them and we can get them up for you.
Sure, I'll be in touch with you, because I've got a few updates that I want to put out.
No problem. Yeah. No problem. Thanks, Shahida. Thanks.
Thank you.
Thanks, Shahada. Okay, I think we're going to move on to our next agenda item. So Rohit has joined us. Hi, Rohit. He's here from YOH. which is an organisation supporting young people in the boroughs. So I'm going to pass across to Rohit. So please take it away.
Super. Thank you, John. Thank you for bearing with me. I've just just joined the meeting as well, like John said, a bit late, but also I've joined Yo late January this year. I'm the head of fundraising, and when I first met with Hackney, the idea was, I think I heard of your platform and I said, why not? Because I'm sure there are so many cross-cutting areas, and I think that's what I'm hearing from Krista's presentation. The last few minutes only I could join, but very briefly, first to, of course, introduce Yo to of you who do not know. So we are a community-led charity. We've been around actually since 1999, based in Hackney, but also in Harlow in Essex, and we support young children from 8 to 25, so quite that range. But the children who are marginalized, vulnerable, or at risk of exclusion, and we've created this space. We are housed in the community center, the MTV housing, and there we have this hub, which actually is a hub for young children to come in and experience a whole host of activities. We also have outdoor activities included as well. But the idea is to meet young people where they are, that is at the estates actually. So we have a lot of detached youth work, and from there to basically build an association, a partnership, so to say, and take them through a whole journey of experiences and helping them build their confidence. I do have this little PowerPoint, which I hopefully should have no technological issues in sharing. Let me go to it. Where are you?
It's the button at the bottom that's like a square with an arrow inside it.
Yeah. I'm there. No, I'm there.
Okay.
Just trying to see, because I have a PowerPoint open. Where is it held? Not in Teams, sorry. I have this PowerPoint open. Should I share with under a window or something, or on a?
Do you want to send it to me on email and I can share it?
Oh, good. Let me do that. I'm sure I've done that before, but okay. Okay, this is. Sorry, everyone. I didn't think it will take that much. Okay, the email. Oh goodness, it's a large file now.
Sorry to interrupt, but you can keep on sharing directly from here. So you have gone into the window. You just have to select the PowerPoint presentation, and it should start presenting.
I know I've gone into the window and it's not giving me the option there to choose the PowerPoint window.
I think you can actually click it when you. So if you go on the share button at the bottom, it will come up with that box, and it will have like at the top it will have Chrome tab, window, and entire screen. If you just click entire screen,
let me do entire screen.
Share, then you can. Then we'll see whatever you're doing on your device, whichever tab you're on. So you just obviously stay on the. There you go.
Right. So as I was saying, so Yo has been around since that time, and what our approach is, what makes us different. I think the next few slides should help to unveil that. Few statistics which, as I was thinking, when preparing the presentation, this is of course not off-putting. This is not to but this is reality. About how the percentage of children living in poverty in the borough are, or out of work benefits, or where the borough ranks today as compared to other London boroughs. But what that actually says to us is, to all the children that actually come to us, and what they feel, if they feel left out because they cannot access certain provisions. I think our work starts there and then. I had this video. It's of course it's quite long. If I can, because I'll have to see if the audio goes through. If it doesn't, then I will stop. But the idea was to show you just a snippet.
Wow. I mean, where would you want me to start? I started here when I was 16. And man, growing up was really rough. It was really rough. I mean, I started struggling in primary school. So, I kind of noticed that I wasn't like everyone else from then,
I'm skipping to this point.
That's how I got involved with yoga. They heard about me, so they would see me around the way, and they caught me acting out of character, because three of the kids that I actually used to recruit, got shot and died. And that just really ticked me off, because at the end of the day, it was my fault. Those kids wouldn't be in the gang if it wasn't for me recruiting. So it was my fault. And that's what I find hard. That's even till this day, I lost my friend, but those three kids, that was my fault. And I had to really work through that. At first I didn't want to go in with these guys. I didn't want to come in. I didn't want to see them all day. To me, you're just trying to find out information to give to the police. So I didn't want to know. And eventually they got me to come in over, they said we were meeting Hoxton over a pie of mash, which was my favorite. So cool, that deal, I'll come in. And since then, we kind of, I started to let them in a bit more. Started to come into the central comment sessions where I was assessed. And then after that, I had some more sessions where I started to come a bit more frequently and get involved in activities. And before you know it, I was, this was home. And that was the real love that I started to get shown. I didn't understand what love was, or how people were to care. I didn't understand any of that stuff. And they showed me the right way, how people care for you, how people look out for you, how people actually see you and want to help you move forward in your life. It's been amazing.
I'll just put this up again. So I want to see you all as well at the same time, because then I don't know. Am I still audible?
You're still audible, yeah. I think if you stay on the slideshow, it's probably
no, I'll be there. So basically, why I wanted to show that, and of course, I'm aware of the sensitivity, of the video, because as you can see, who we work with, they come to us in confidence. But I think, this was what, a 15-20 minute, even longer video, but I showed that snippet because I think it summarizes the journey takes these young children, from, and this person, came in, when he was quite young. Now he's serving security at a Michelin star restaurant in London. And his story, like many others, many other stories that we have, is a story of transition, coming in from these negative experiences, having a loss of identity, but then within the YO's trademark 16-point framework of transition, they're taken through, taken out of those experiences, given new opportunities for skill development, for even something as simple, like he said, care and love, feeling that there is somebody that they can confide in, they can, an environment that they can, sit in and share, and if not nothing else, if not, learning a new skill. And that's where it starts, that transitional journey with us, and then the identification, the reinforcement of a new identity, as we just showed in this case. And of course, I think, as will be true with the third sector, the charity sector itself, is that, why do we exist, is because the government is doing enough, but then there are always gaps or provisions that are left out, because either you cannot do enough, or what you do is a bit blanket approach, and then there are elements, or in our case, young children who are left out because of that blanket approach, who do not fit in the criteria. So who looks after them? And I think that is why we exist. And as I've just said, we work with marginalized communities. We work with people that have slipped through the net of existing provisions. We provide end-to-end service. So it's not that, so we don't really just work on one element of, say, providing a meal once, but actually we work on making the young children capable, that they can not just, and they don't just access that one food bank, but actually then they become capable enough to actually go out and get employment, or go back into education, and then fend for themselves for life, and build in that phase. They also build tolerance, respect, bravery, and courage for themselves. This, as I was saying, a very short snapshot of how we start. We start with engagement, and which is mostly detached. So this is on the estates, outside, on the streets, actually engaging through young children. So our youth workers engaging with young children at these estates, finding out like if they are there, for example, at school time, or other unholy times, to see whether they would be interested in coming to the center. And that just doesn't happen immediately. Like, they don't go and ask whether you would be interested to come to the center. I think they do start with building a rapport, and then from there the journey starts of for them to come in. There is a phase of personal development. They're opening up, and once that happens, once they feel comfortable and safe in that environment, then goes on to the next level of helping them identify. So we don't have a set structure of, say, 5 activities. It doesn't work like that. It has to be really tailored to each child's interest in development, and that's where we help them develop their skill, and then lead them on to positive pathways, which, like I said, it could be education in many cases, and then in other cases it could be employment. So we have for example, association partnerships with some corporates who welcome these children into their environment, which they can actually go and see how things work, how the TFL works, how Cineworld works, how the banking system works. So they go and experience firsthand, and that ignites a lot of enthusiasm, inquisitiveness into the children, who then come back and then go on to find their career pathways from there. And while all of that is happening, the assessment, tracking, and mental health through professional support is always there for the children, which, like I said, so they have an individual development plan, which is partly formal, partly casual, and the mental health worker referral and the observation of these plans. And these plans are regularly reviewed with each young person. And I mean, the impact, I think like you just saw in that video, I think the impact we're talking of that works is basically, you know, the transition that these children go through, which takes a lot of time. So of course, one of the challenges I must say as a fundraiser for me is fighting with these, you know, 1 or 12-month or 1 year funding applications, and you know, wanting to ask from us a lot about around impact, you know, around outcomes of, you know, what that funding is going to do for us. And that's why I think in many of the charity conventions that I've been to, this is an ongoing topic, which is, you know, there should be, you know, an interest from funders as well towards long-term funding, and that is how, you know, we achieve what we achieve. All of the transition you see, and there are other examples of people where, you know, you see it takes, I don't know, 2 to 5 years to 10 years to actually see a real change. This was quite a snapshot. I will stop sharing and, you know, happily take on if you have any specific questions. With this presentation, I'm sure I'll love to, you know, join again as well, and thank you, John, for that. But the idea was to join the community, give a snapshot of, you know, what Yo is, and of course there is 100 more things, you know, the bravery awards that we have won over time. There are currently some awards we are almost waiting to hear back on, and I think the mayor's recognition of your CEO over time. There's a lot of legacy that exists, you know, and some of which I've seen, you know, personally, attending some sessions at the community center just last month. The enthusiasm of children, for example, we are engaging them in a food session. So like I said, you know, yeah, it's nice to give handouts, but in the session that I saw where they were actually also cooking, there was a professional chef there, and they were each one of the child was actually involved in cooking a meal for themselves, thereby getting introduced to, say, new vegetable and new textures and tastes, and enjoying that meal nonetheless, but at the same time learning so many other abilities, you know, while they were doing that. So I think that's what makes us different, but that's also what makes us, I would say, open to collaboration, open to, you know, opportunities to collaborate with people on the call. So yeah, if you have any easy questions for me, surely shout out. Any difficult question, I'm going to write and come back to you later.
Thanks, Rohit. That was great. And yeah, you're very, very welcome to join this community, and yeah, keep coming along and getting to know people on the call. It's great to have you here. Does anyone have any questions?
Yeah. Hi, so I'm Patricia, and I'm part of the brunch bunch. So I was just really interested to know, I'm from Hackney and I've never heard of your organization. So it's interesting how do you advertise, and where do you advertise in? Do you advertise in hospitals, doctors, schools? Because that is what your work is fantastic. And I think a lot of kids nowadays, especially even my daughter, she went through the pandemic. It was her exams, and it was really rough times. And then there was nothing after to kind of engage or bring her back into, you know, what they went through. And it still affects her now. She's 18 and not sure what she wants to do. And yeah, so that's a really good organization, but I've never ever heard of it.
No, thank you, Patricia. I think I second the feeling, but I would say, so mass advertisement is what we don't do, and I think everything I say eventually will come down to funding, right? Because if we had, you know, the kind of funding we think, but to basically, yes, to answer your question, generally, we don't mass advertise. Like I said, our work is a very, you know, connected one-on-one on estates. That's what the youth workers do. So there are leaflets, you know, distributed around, for example, say outside stations and, you know, outside schools, depending on, you know, if we were promoting an activity. Of course, there's a community center and they have a lot of visitors, so there is that existing knowledge there. I can certainly go back and check with the CEO, you know, on how, if like you say, you know, being in Hackney, you haven't heard of us, on how to increase or, you know, find out more. I mean, we are on social, so we are on, you know, TikToks and Facebook and Instagram. So I'm looking at the questions as well coming in the chat. So I'll address those as well, kind of linked to yours, that how can you all know more about Yo? So surely I can start from here, like from today, So, but I think one of the issues that I saw when I joined in was that, well, because there is funding is a constant challenge, there's not enough resource to mass publicize in what you do, because then how do you actually handle that influx? So I don't know if I've answered your question, but partly I'll take this back and see how we can do more on advertising, but partly that we do. But yes, sometimes the kind of advertising we do, I know it has touched so many children, but not all.
Absolutely, it's fantastic work. Thank you. Maybe you might collab with the council, maybe Hackney Council, something like that. But thank you very much. Thank you.
Thank you.
Thanks, Patricia. And yeah, I don't know if you're aware, right, but I circulate, well, me and the team circulate a poverty reduction newsletter, which goes out every fortnight after these meetings. So
yes,
if you want to send me your slide deck and also like your socials, links and everything like that, I can put that in the newsletter, and that goes to, I think there's around 700 people on the mailing list. So
there you go.
That'll be one way of getting the word out. But
that's exactly that's very helpful, and thank you, John. I'll do that. I think that will leave many of the children like yours, Patricia. During COVID, we have so many stories again of children feeling so kind of left out, but just this center was like this little beacon of hope that existed, and how they actually were able to cope up mentally, mainly mentally. It was not about provisions, it was mental support that they got through.
I was just going to come to Jahada's questions in the chat. So she was asking what YO stands for. Is it an acronym, YOH, or is it just YO?
Yes. So I said we started in 1999. We have kind of a big group and then broken into small and gone through a transition. In 2007, we formally registered as a charity. So Youth of Hackney.
Right.
But yeah, it has gone through some transitions. So yeah, you could mix with Youth of Haggerston. But yes, so yeah, that's what we stand for.
Cool. And Jahada also, so Jahada works at HCVS. I don't know if you're aware of HCVS.
Yes.
So she coordinates their children and families forum. So that would be a really good place to go and speak at as well. So maybe if you put your email in the chat, Rohit, then Jahada can get in touch with you. That would be cool. Jenny, did you want to come in?
Yeah, it's really great to hear about your work, Rohit. Thanks for joining us. And yeah, do come back when there is sort of, when you do have capacity on a program, or you have some spaces for young people, you can always just come in to this space every other Thursday and just let people know about it on the call, because it does get out to people quite quickly. So where you have spaces and capacity, then we can get out to those networks. I was going to ask particularly about the things that are hard. I suppose we hear a lot about how challenging it can be sometimes when you're working with a young person or an older person, where you have a certain set of services, but you can't provide everything they need. And obviously you need to work in partnership and collaboration to be able to draw in the support or make onward referrals. Are there any particular challenges, that are helpful for us to be aware of? Any particular partnerships or challenges in the system that you're experiencing when you're trying to advocate for the support that young people need, or where are the biggest blockers, I guess?
So so there's a couple of aspects there. Funding being one, introduction to services being the other one. So again, coming back to the point that I'm here for, potential collaborations, because we do not have any in-house skill set, so to say, right? So we go to say the corporates, right, for them letting us in. So I think those sort of where needed, the introductions, that might definitely opening the door to that. And because like I said, some of the children, when we took them to the financial district, Canary Wharf, they were flabbergasted. They were like, they didn't even know if something like that existed and how, the whole banking system works. That opened their eyes. And while when you're there and in that presence of that situation, it feels like, the wow. But actually, when you go back home, it opens up, like I said already, opens up that endless, opportunity, the door to that opportunity, that wow, this is where someday I could be. And that is, and this is just one example. We've done similar shows. So maybe some more introductions that would really be heavy. These are not always cash intense incentive. They could just be, their support in kind, them opening their doors, and those introductions that can really help us, of course. I can't really think of too many. Of course, I didn't really come here with the mindset of, thinking
No, I guess
like their challenges are, like I said, sometimes working on, bigger funding opportunities where we could collaborate, with other provisions, food and, mental health experts, because we are not the experts in that. And, and with them coming to, like I was listening to the previous speaker saying that, the issue of collaborative community space. Well, I'm not offering because, I'm not in a position to decide on that, but we do have one, right? Which is intensively used around the week on Phillip Street. That's where we are based. In the Whitmore Community Center. But that space definitely needs some help in terms of, developing it further for children. So partly comes down to money, partly maybe, some decisions only, from the council. So I think collaboration, partnership, introduction to corporate, and then of course funding as part of, your revised strategy, those consultations. So I'm very well aware that yes, you are more than open to, consider.
No, that is really interesting. So we do have colleagues working in the council on work around community space and council assets. So I'll definitely put you in touch with colleague Alice on that, who is working with all those community partners who are sort of interested in thinking about collaborative opportunities around space. So that's one thing we can do. But that's useful for us to know, because we're often looking for opportunities to connect people up where we know, whether in this space or in other spaces that through the forum, for example, that Jahada mentioned. But Michelle, do come in next.
Hi everyone. My first time attending this meeting here, but just wanted to introduce myself. So I'm a youth worker with Family Action, and I'm currently working on children and young people's mental health hub in partnership with Young Hackney. So I'm currently based at Forest Road Youth Hub in Dalston, working as part of Health Spot. So I don't know if you've all heard of Health Spot. It's like a one-stop shop for young people where they can come in and get support and advice from various different teams. So you've got smoking cessation, you have the health and wellbeing team, you have the drugs and alcohol, they have access to GP. And what Family Action does as part of this, we have 2 therapeutic youth workers that are based there throughout the week. So I'm there on a Monday and a Tuesday. I have a colleague there that's there on a Thursday and Friday. And we provide one-to-one support for young people for 12 sessions. We also do group workshops, pre-employability workshops. We also have 2 in-house counsellors as well that young people can see. And we see young people from 13 up to 25 and those with additional needs. And we're quite flexible as well, so we can meet young people face to face, over the phone, have sessions, or via Teams. And we work in a trauma-informed way. So we meet the young people where they're at, look at whatever barriers they have that are negatively affecting their mental health and emotional well-being, and work with them to put together a package of support to embed them in the local community, but ways that they can manage, not necessarily overcome in 12 sessions, but be more controlled over and informed about their futures, and how to move forward, working with strategies. We've also got a youth worker based in Hoxton Hall as well that runs a girls group. So I'll put my information in the chat if you want to find out anything more, and the link to the HealthSpot landing page, which I helped co-produce with some young people before the service was launched last August.
Great, thanks, Michelle. I think we actually had Aretha come along to one of these sessions a month or so ago and talk about all that great work. So yeah, great to have a reminder. And if you want anything included in the poverty reduction newsletter, which we send out, just send it my way and I'll put it in there. Jenny, did you want to come in?
Yeah, and I guess, for Michelle and for Rohit, just keep coming back when there's things that you want to connect into, or, there's even if the people aren't on the call, often people on the call know someone who knows someone. So I think it can be quite a helpful space to make those initial connections and then sort of spark off from there. So if you need any sort of further help with that sort of thing, do let us know.
Thank you. That's very helpful. I will still stay on, hit the other speakers.
Well, we've actually got 8 minutes left until the end of the meeting. So usually we sort of, but thank you for coming along, Rohit. That was great. And yeah, as you say, please do keep coming along. And Gozi, did you want to come in?
Yes, good evening, everyone. I think this is, it's not a question, good presentation from everyone, thank you. And I think this is for you, Jen, the Here to Help newsletter. Charles is not here. I would have directed it to Charles. I think he's on his honeymoon now. So I have this client, she's been moved to a new property. She's 65. I saw her today actually at the service center, but her problem now is that she hasn't got no cooker, no fridge. So I said to her, I'll get back to her Monday. After this meeting, I will get some information where to help her. She's got a sofa, which was given to her by a church. She got moved into one of the buildings for elderly people 2 weeks ago. And she's struggling with household furniture, white goods. So I don't know how I can help her.
Have you, just to say quickly, when we're talking about sort of individual cases in this meeting, just because it's recorded, I know you haven't done this in Gozi, but just to say, like, to try not to share sort of any identifiable information about that person. But in terms of your question, have you made an application to the Here to Help team at the council, because they do provide funding sometimes for household furnishings? So have you made an application yet for the Here to Help team for that resident?
No, he said she's got the one-off funding, which she thinks is not enough for her to use. So I was thinking if there's any more we could do for her.
There is Idia's community kitchen that does sometimes have furniture. I don't know what, I know they've included their information in our newsletters before, so I'm sure we can share those in Gozi. But also, Hackney Parochial is an organisation that may or may not, may be able to help. I'm not sure of any others that we know of, but if does anybody else on the call have any other suggestions for where kind of crisis
Hackney hubs, they can help, and even on our community newsletter, I don't know if Krista's still here, but on our community newsletter, it's Hackney based. There is actual list on there for white goods where you can get help for that. There's one in Tottenham, if I'm not mistaken. But I don't know if Krista's still here, but there is one on our leaflet. I'm so sorry, I can't tell you off by hand. But yeah, maybe at an Hackney hub as well. Yeah.
Okay, thank you very much. Thank
You're
you.
welcome.
I'll try that, and I'll get back to her on Monday.
Thanks, everyone.
Thank you.
Yeah, Patricia, if you're able to send me those details, maybe I can pass it on to Ngozi.
Okay, I will do.
Cool.
Thank
I'll put
you.
my email in the chat in case you haven't got it.
Thank you. Okay.
We've got 5 minutes left. Jenny, did you want to come in?
Only just to invite anyone else to share anything they want to share. So anyone got a question, any insight they want to share, any feedback from anything that they've heard today, any thoughts, any ideas, any connections you want to make, anyone you want us to come and have present at the session. Sounds like everyone's run out of steam. We've got 4 minutes left anyway, so maybe we'll draw to a close. But thanks so much for joining us today, everyone. It's been a really, really rich session, brilliant presentations, and yeah, really great to see you all. And thanks so much for all your amazing work. For those who missed the video at the beginning of the session, we're going to share it. We're going to get it up on YouTube and share it in the newsletter so you can start to get it out there, because it's been an absolute pleasure to be able to share it with you, and really pleased that you feel it represents the work that you all do and value. Thanks so much, everyone, and take good care. All right, see you next time.
Thanks, everyone.
Thanks so much, John.
Bye. Bye.
Bye. Bye.
Bye, everyone.
Bye. Thank you. Thanks, Pat. Thanks, Chanel.
Oop, how do I leave? Have I left? No, I haven't left. And I had to leave.